when did this problem start?
So this situation is like signal not working. Doesn't mean we just stand. So now think of this. When do you think this has started?
The child is vested as well as stunted. So the problem must have started long back.
Yes, so long back years, okay. Long back में सोच है, if I meet my enemy, college में रहना, and if I meet a friend yesterday, shit, कितना दिवस तरीका मोड़ा था. So that is relative. We want you to decide whether this must have gradually coming down or fastly coming down.
But sir, if we have previous readings also, so we can also plot. If readings only available.
No, agreed. See what we are teaching just now.
Height for age.
Ideal, yes, yes sir, coming to you sir, 1 minute. Ideally we should have previous readings and we should look at the whole graph. But today what we are teaching, as sir said, is practical, that the pediatrician before you may not have put anything. So then what to do? So there is a way, we are learning that. So sir is talking about height for age.
To know the onset of disease.
So now the clue is in the height. So look at it carefully. What do you think is the height shown here just now roughly? What is it? No, number 78 roughly for a 2-year-old. Okay? You all know that at 1 year the height should be 75. So do you think at 1 year 2 months this child's height button was switched off and he stopped growing? Do you think that has happened? No. Height slowly slowed down, no? Normal speed say less, and that is how slowly it has reached here. So when do you think it would have slowed down? At 18 months or at 12 months?
So for that, tell us what is the height of a normal 2-year-old?
Normal 2-year-old? 87. Fantastic.
Okay. Normal to 87. This child is 78. So now, when must that have started doing? What we want you to understand is, when he has done fairly well, of course not normal, his initial fast growth must not have been anyway disturbed, but thereafter, पहला 3 महीना में तो फास्ट ग्रोथ है, पछीना 3 महीना में थोड़ा स्लो था, पर 6 महीना પછી હજી સ્લો થાય.
So he has reached 78 at 2 years. So he must have started slowing down at 72 or 74 or whatever, and then he started.
Height of the child, history भी कह सकते हैं, growth chart भी कह सकते हैं. We have so many resources, but we don't use any one of them. So this is one example, right?
So this was faulty. Right. So when it is, so now you remember the discussion we had, ki when there is a illness, what gets affected first? Weight. Then height. So will weight and height be equally affected ever?
Constitutional.
Constitutional. Fantastic. Give him a clap. So what is, so if you trace the old readings, this child has always
Will help.
okay. So actually he started going to school antenatally.
But these parents were tall and even fat, and they were saying, બધા પૂછે છે તમે જ ખાઓ છો, આ બાળકને નથી કંઈ આપતા. Now what have you to say that? So parents are abnormal, the parents are happy, so child must be abnormal. This is the third form. So this one needs only counseling, this one counseling about that. Let's see the third form.
And this very early. So that's the learning point from this, that the onset is very early. Now you fish out some old records and you was on exclusive adequate breastfeeding at that time.
Ask for all tests. Is there a possibility? So what question do you want to ask the parents to differentiate reasonably correctly? initial defect in the first 3-4 months and several infections, opportunistic infections come up. If not, another important 2-year-old child. What happened when he took a lion vaccine? Pneumonias don't cause much. A pneumonia which coughs badly is an airway plus pneumonia that is likely to be severe. Mean the history can guide so much कि अपने बच्चा टेस्ट करवाने की जरूरत नहीं.
That the weight of this girl is here. So does it bother you? You started using a growth chart and you found that the weight was here. So now investigate for Cushing's, hypothyroid, Lawrence-Moon-Beadle, monogenic obesity. Okay. So see the height first.
Sir, height of nonsense, time can say.
So this is the height. Now what do you think?
This can be normal.
Normal.
So this is the new normal. I just add one word before Chokhani sir. This is the new normal. Okay, what do you mean by new normal? Malnutrition. M-A-double-L nutrition. Correct? So you know that this is
Exogenous can be. So who has been successful in managing exogenous obesity? We will change the doctor also say. Our family में बताया was happy से. So you never can be successful because the whole family has to change. And who changed it? My school friend kept on smoking. I said, that open लक्ष्यों से dangerous to health. He said, आप बंद करेंगे smoke करना. Where is the problem? Okay. So it has to be prevented.
and we said yes. So if I was plotting at every visit this child, then I would have got a growth record like this. And I could have taken action at that point and explained to the parents, at which time parents would have listened and child would have listened. Now at 8 years, neither will listen. Correct?
પેલા બે ત્રણ વર્ષમાં સર કેટલું દુબળું છે વીક છે બરાબર I asked the mother વીક છે ને તો દિવસમાં એન્ડ ઓફ ધ ડે થાકી કોણ જાય છે તો તે થાકતો જ નથી હું જ થાકી જાઉં છું તો તું પછી 4-5 વર્ષ નીકળી જાય તું ત્યાં પછી 8 વર્ષે આવે તમને જોયું છે ને પેલા કે હવે he has become fat but you are expert in keeping them overweight. Don't become obese, but if you are thin, don't become overweight. Okay.
Okay. Now, so we'll have show of hands. Okay. Basically, this is just to learn. Nothing is about right or wrong. Okay. So look at this. A 6-year-old girl has been brought because she is among the shortest in the class, and
Because it is following.
right? That is familiar. And what is constitutional? Sir is our expert, so we will not allow him to speak. We will come to him in a difficulty.
The growth is accelerated in pubertal phase and it will achieve adult height.
Excellent. So the growth will pick up near puberty. Initially it will look short, but finally good height. Mental height would have been lower. Right? So you can predict, and practically how do you do that? You ask the parents, one of you were short initially and picked up in 8th, 9th, and they say yes, and that is a confirmation. You don't even have to spend on a bone age.
Possible the height or weight velocity. Okay. If I am growing at the height after say 2 years, only 5 centimeters a year, you are doing it 6 centimeters a year. Right from year 2, then we will be wide apart at the end of puberty. But both of us will be normal because my growth velocity is smaller than yours. So growth velocity is a good idea. If you are keeping up the same growth velocity, you are normal. But if you have a hormonal problem with short stature, then your growth velocity is slowly going down. And therefore, if possible, check every year whether the velocity has remained the same 2 years onwards. But by 8 or 9 years, 7 to 9 years, there is a small hump there, which means a little faster, again slows down, and then at adolescence. So velocity chart also helps a lot.
Right?
So these are the growth problems.
No. Good point you brought. Nutritional intervention, answer is no. What sir just said. So such families feel that we should push more cheese, butter, sweet stuff and make her put on weight. No. If you do that, you will end up in a metabolic syndrome. So she is designed to stay here. Right?
So far we have discussed problems with growth, which parents come to us, recurrent illnesses. Now we will actually try to diagnose even diseases. Okay. So let's see the next one.
So now ulta. Okay. So now
Take a deep breath and start thinking.
this is the first infant who is 6 months old who has come chart of that infant. Now think and bring up possibilities and then we may narrow down on
Because the weight and height are normal.
means what?
Acute illness.
So weight and height normal, yeah.
Sir, acute onset breathlessness and no cough and child is 6 months old. So
Acute breathlessness, no cough. Foreign body will have cough. Right? Yeah.
Okay. So what did Dr. Chokhani say? From the growth chart, what have already plus no cough, therefore bronchiolitis, and no fever or mild fever or whatever, right? Okay. So this is acute bronchiolitis. This is the second child, six infant, 6 month old, who has chronic breathlessness. Sir, તમે expert. So pick up the age where height velocity is decreasing.
the previous visit 4 months.
3 months.
Okay. And what is still this pattern, which means this is chronic disease. Now which chronic disease will come with breathlessness, chronic breathlessness? Any other disease?
Metabolic disorder.
Very good. Metabolic disorders. Excellent. Any other? RTA. Yeah. So renal tubular acidosis, all those big group. Yeah.
PhD or we present with failure and breathlessness, and because of which the growth may falter at around 3 to 4 months.
As VSD with left to right shunt, will have cough as a major.
No, sir.
Left to right shunt.
Left to right.
So left to right shunt is a cough. And this child has no cough.
So growth from congenital disease faltering from initial month or only.
What about cough, sir is asking? Congenital heart disease should have cough or should not have cough?
Having cough.
Having cough. Very good.
So possibly pulmonary stenosis, aortic stenosis. There is no cough. Could that be so? And the answer is that rarely present so early, and if it presents so early, it's life-threatening. And aortic stenosis severe will come with shock in the first week of life. Same is the story of a pulmonary almost atresia. So it is not that, and therefore this is not a congenital heart disease, right? What about CF? Again CF, we say CF is an airway disease with complication of a lung parenchyma. So again a cough. So this is not CF. Then what? Interstitial lung? Interstitial lung has no cough. But interstitial lung coming up at this age is almost something that he has had prenatally as well.
So there are two things that we now narrow down on. One is interstitial lung disease and one is renal tubular acidosis or other whatever reasons you said. So the difference,
chronic interstitial.
so there is a difference in the growth between both of them, the speed of deterioration. So this one, slow grow weight deterioration and then later height deterioration. And the third child, if you see the difference, deterioration is even more. So usually a metabolic disorder will have worse situation compared to growth failure and chronic breathlessness. So what did we learn? That even without any history and examination, we could come down to those four, and from that no cough separated out.
Amount of breathlessness with less respiratory. Breathlessness is an effort at breathing, and how do you pick up that? Chest retraction. Correct? Good. So see now, all of us know, but we often don't think. Therefore we have no answer. She started thinking. So she has an answer, right?
Okay, next.
Breathless, no?
No, sir.
Three guys?
Three.
So we want to now just show you a sample of some different areas. Okay.
These normal are is
પણ એના સ્ટેરોઇડ આપો ત્યારે હાઈટ ઓછી થાય ને.
steroid not started as
So he is giving a diagnosis untreated nephrotic syndrome. क्या कमाल है. Okay, very good.
And why has the weight gone up? Edema. Fantastic.
So the point here itself is the velocity part which sir mentioned. This is non-physiological increase in velocity. It goes fast, not हो ही नहीं सकता है physiologically. So that point has to be picked up. And then it's not true body weight which has increased. There is something else that has increased. So obviously it is fluid.
Excellent. Yeah. So this one was nephrotic syndrome. So let's take it further. You started thinking. Now congestive cardiac failure in pediatrics, when we see, it is due to an acute disease or a chronic disease? Dengue. Fantastic. Very good. So this.
And first picture as well as second picture. Can this be because of malnutrition? As you said, MALL malnutrition.
So I think your point only.
So parents are super. Very good.
Okay, so this is capillary leak. Fantastic. And this is the third child with edema. Occur. Anything else? Chronic kidney disease. Anything else?
Chronic infection.
Chronic infection. Why should they have edema? Chronic hepatic. So everything. Chronic heart, chronic hepatic, everything. Right? Okay. And you already said kwashiorkor. What do you think? So the key is in interpreting the chart. So interpret the chart and then you connect it to the story. Okay, we'll come back to that.
Because the weight it won't be less because of
Excellent, excellent. The weight will not be affected. And when has the weight started getting affected? Almost at 2 years or even earlier. So because we don't have the chart before 2 years, you don't know when it started getting affected. So at least 2 years.
Due to whatever may be the reason. So there is a later on growth failure that happens only in the bronchomalacia.
Okay. You want to support cystic fibrosis further? We are all fighting. I think 1/4 person should say steroid toxicity, and then that is the best. Everybody agrees this is not steroid toxicity? Very good. So now, any more points in favor of cystic fibrosis?
Both height and weight affected, early in age.
Fantastic. Sir.
Bronchomalacia be poorly controlled, but still not faltering. He is not a problem of a poor treatment, but something different. And I think keep that in mind. Of course, many of them have a clubbing. Now, asthmatics also may have hypoxia, right? But they have a club. What is that?
Sir, hold mic closer. Sir, mic closer.
Could be a washing out of CO2. Okay? And what have we done? If you saw a normal CO2 in a severely breathless asthmatic, he is already in the respiratory failure. You don't have to wait for CO2 to work. Because he must start with a lower CO2, then come to normal when he worsens. And if you don't pick him up, then he is almost on that way. So in an asthmatic ABC, you expect a low CO2. And thereafter maybe hypoxia, right?
Metabolic disorder or neurodegenerative disorder. Fantastic.
Neurodegenerative, right?
Okay. And the last one, the fourth child with what looks like a delayed child. So when I say developmental delay, look at it as the child is looking delayed. Hydrocephalus, fantastic. Very good. Now cause of hydrocephalus. Is it congenital or acquired? So acquired is TPM, fantastic.
What a power, what a power, good.
So without history, without examination, on a growth chart you have diagnosed TPM with hydrocephalus. Isn't that a reason for a party tonight? Okay.
Physical and mental. Behavior is expressed mental.
Okay. Anybody else? Any thoughts? Yeah.
The social part of milestone maybe it is regarding behavior. It may show the behavioral part, but the development part is those 4 milestones. One of the that might be.
So, development is milestones. Okay.
Behavior is an expression of mind is doing. Okay. And what does mind do? The mind feels, mind sees, mind thinks. But we don't know what mind is doing, which comes out in an expressive form, visible to us, and that is called behavior. So behavior tells you how the person is thinking, how he is acting, and I think that's the behavior. So when you talk about development, you must talk about behavior as a very important part of development.
So the confusion starts with the difference between growth and development. So what is growth?
It's the physical part.
What do you mean by that? Sitting, standing, it also.
Defining various parameters, height, weight, and density, that is growth.
And yes, anybody else?
Growth is the increase in the size of the cells and number of the cells, while the maturation of their function is the development.
Excellent. So anything which is an increase in the size constitutes growth. Which are the parameters that you look at increase in size? Weight, height, head circumference, and in the first 1 or 2 years, chest circumference, then upper segment, lower segment, mid-arm circumference. You are measuring parameters of size, and that's from each cell to a tissue to a system to the overall body. So what is development? Gujarat is the best place to talk about Vikas.
So give an example in the body of development. We are saying it is, sir has already said, it is maturation of function. So give an example which all of us know, say in the newborn period, which is a sign of maturation of function. Or pehle,
Child
newborn.
starts recognizing others.
Social smile.
Okay.
Social smile, neck holding,
Okay.
sitting, standing.
Okay.
So the most important reflexes, the most important part to understand is subject is taught to us in the textbook And in textbook, you have to have parameters. Story ऐसा नहीं होता है, life ऐसा नहीं होता है. Development is basically the acquisition of new skills for new functions. जो आप कर नहीं सकते थे, अब करने लगे हो, ये development है. जो नहीं था, अब वो हो रहा है, वो विकास है. So doing something which you did not have the ability earlier is development. So development is acquisition of new skill and new function. It can be seen by others by parameters. So milestone is one measurement where I know that this child has achieved a particular skill. But the most important part to call it a milestone is to understand the meaning of the word acquisition. Acquire it.
We have learned.
It wasn't there earlier, but now it is there, it has been learned.
So what is the difference between acquisition and learning? Is milestone learning? So learning is the process in which you are internalizing that ability. You are learning it. Acquisition is when you become master. What is the meaning of master? Now you cannot lose it. A child is sitting independently for a few days, then has a bout of diarrhea, gets admitted, acute gastroenteritis, 3-4 days comes home, is not able to sit. That was not a true milestone. If the child had acquired a milestone, he will come back from the hospital, continue sitting. So mastery is when you have acquired the acquisition of new skills and new functions. And it proceeds in various domains which we have divided for our convenience. Motor domain, social communication domain. So these are our for ease of marking in the chart. But it is a mistake to consider development as milestones, because then you are only judging, you are not understanding the story. Like we showed growth charts now, we showed the marking, but what did Sir and Dr. Rajesh Chokhani sir tell us? What is the story? Why was it going well? Why did it start dropping down? Because as doctors, we have to utilize the history of milestones to understand the process.
Just to give an example, when does an infant start sitting? He said it's a process. एक दिवस એવું नहीं आवे, he started sitting. When does an infant start sitting?
Roughly
6 to 9 months. Anybody else? When he starts sitting?
5 months also.
Maybe 5 months also.
5 months. Irritability? No, that is the process he is talking about.
So he is saying with support. So all of you know that sitting is in stages. First is forward propping, then lateral propping, then able to sit without support. So what exactly Samir said, it's a process.
So the key issue is sitting with support and sitting without support. Sitting with support is still the process of learning. Sitting without support is the process of mastery, acquisition. Why is it important? Because the child who was sitting without support, એટલે master થઈ ગયા, and then something happens and he cannot sit. That is true regression. But if you are sitting with support and now not able to sit with support, it cannot be considered regression. So you have to be very clear about the history. Don't write child was sitting at this age. Whether child was sitting independently, standing independently, walking independently at that age is very important to ask.
When does the language start? After 2 years. 1.5 to 2, language.
Sir, we'll come to that with relation to the case. So now you talked of behavior, somebody said. So Samir, what does behavior involve? Does it involve understanding? Does it involve only socially skills? What does it involve?
Please understand that when we use the word behavior, we are judging some other person. No Western textbook will tell you this, but real is. And now behavior aim change. God has not said that. I am judging his behavior. So all behavior which we say is judged by the observer. So it is an observation And in that way, like sir said, it is the expression that we are seeing. Is a child active, less active or hyperactive is a behavior, and all behaviors are symptoms. Why is a child hyperactive is another story. So please remember that all behaviors are symptoms. They are not the cause. I am having some new shirt जो पीछे लेबल रहता है वो irritate हो रहा है मुझे. You may say I got tics. You may say I am hyperactive. You may say I am disrespectful to sir. I am not standing properly in front of sir. You are judging what you are observing. बाद में पता चला कि नहीं वो टैग इधर इरिटेट कर रहा है, इसके लिए मैं ऐसा कर रहा, अदरवाइज कोई नहीं करता है. So you can never decide behavior in one observation or one setting. So to judge behavior, you have to know the story. Why did Amitabh Bachchan become the angry young man? Not because he was hitting 30 people. Because in childhood, he was treated badly. He saw his mother being treated badly. He saw his family being treated badly. That's why now he has become the angry young man. So you see behavior, but don't make the mistake ever of treating behavior. Because like sir said, it is only an expression and it is only your observation. It is not the etiology.
So I think that's the most important thing. Look at the words here. Behavior is how you act, means you are observing some patient based on how you think. So that is the cognition. So that's what Samir just said. And feel, emotion, and act as per age appropriate norms set by society, set by you. So you judge, as he said, कि ऐसा करना चाहिए था. So that is the behavior, right? And depending on social environment and physical health, right?
One simple point. Patient comes and says, my child is hyperactive. What do you mean by that? He doesn't sit at one place, keeps running around. Just look at the aspect. If you are supposed to play football, that same footballer finishes game and goes to the classroom. Then again he starts running around. The same speed which he was running there. What will you say? Hyperactive. So what is it hyperactivity? Some tumor causing the hyperactivity? Is it some neurotransmitter? No. It is lack of that person to understand the social surrounding. આ જગા છે મને દોડવાનું છે મેક્સિમમ દોડવાનું છે પણ આ જગા છે અહીંયા સોશિયલી people have decided that social behavior सीधा बैठ के टीचर की बात सुनने वाले हैं. जो आदमी को ये समझ नहीं आता है तो उसका बिहेवियर हमें abnormal लगता है. So the message is look beyond the behavior. Behavior is a symptom. Vomiting is a symptom. Breathlessness is a symptom. Breathlessness with cough, without cough. આટલું જોઈએ છે.
As pediatricians, we monitor growth by height, weight, all that. Can we peep into the mind of a child and look at behavior?
I think mind is very important in pediatric practice. Mind of the mother who is worried about her child is as important. Okay. And then how do you peep into mind? We peep into internal organs from outside. Oh, this liver is enlarged, this jaundice. You're peeping into it. So mind also can be peeped into by the behavior that we see. And I'll give you a simple example. I give you a gift on your birthday and ask you, imagine what is inside. Can you not imagine? You use all your senses. You see how heavy it is or light. You see whether it's moving and making noise. You smell, and after using all sensations, you start wondering, who is this man on this occasion? What must be he giving? Is it edible or non-edible? You can almost make. Mind has to be exactly picked into it.
So the point we are saying is, don't stop at judging the behavior. Hyperactive છે, hypoactive છે. Don't stop at that. Like sir said, that allows you to peep inside the mind. why is he behaving like this? So when you see a behavior, don't write on your file, hyperactive child. No, it's like writing a child is coughing or a child is vomiting. You don't end at that, right? You go on ahead. So go ahead. Begin judging or in understanding why is the child behaving like this.
So, sir, what do you expect from pediatricians with respect to this development?
I think what we are discussing is we get a lot of opportunities to monitor development and behavior both. Because children come to you every 4-6 weeks for vaccination in the first 1 or 2 years of age and use that time every time, not only the physical growth but also the developmental milestones. And now we have learned that milestones include 2 important things, the behavior and the process of coming up to that. And unless you sit, you cannot stand. So unless you start a process, then only you progress. And therefore, Samir always says that you are not teaching somebody who has not achieved something. You are looking at the basic idea. Where did it start? Why did it start? And you treat that cause, you don't treat. So a fever is to be treated by paracetamol, but pneumonia with fever, not paracetamol.
Yeah, so go ahead, sir.
So basically there is onset, duration, progress even in achievement of milestones, not just in chief complaints like fever, cough, right? And how to pick up or look at milestones, use all your skills, use observation skills. When the baby enters your consulting room in the mother's arms, look at what the baby is doing, where the baby is looking, look at everything. Observation gives you so many milestones, right? And then acute behavior change denotes seriousness due to an organic disease. So this is something which you have to, again, onset, duration, progress. कि ऐसा कब से हो रहा है? What is behavior changes since when?
In fact, I'm sure every time I've seen a mother who said, sir, temperature is only 99, but મને સારું નથી લાગતું. આ સારું નથી લાગતું is her impression, her behavior of a child tells her કે સાહેબ બરાબર જોઈ લો, મને સારું નથી લાગતું. Okay, even a lay mother knows. How can a pediatrician know? Absolutely.
So when sir is saying कि mummy is saying मने आज सारू नहीं लगतु, is it based on her that morning's observation? Then it is earlier. So please understand this. It's a track. It's same like growth chart. Only thing you will not be able to plot it. But please understand all. You saw today you are not feeling well. What do you mean? Oh, yesterday he was very playful. All these days he was playful. Today he is not playful.
And for example, can you not even consider a probability when you see a newborn that he is likely to be developmentally delayed? Newborn. And what do you ask a newborn? Behavior. What is behavior of a newborn? Cried immediately. But that's not enough. How is the behavior of a newborn at birth, after a normal delivery? Behavior. Okay. We have been taught, cried immediately, but never stopped also. So, cried immediately is undergraduate. So, how does a normal newborn behave at birth? Behavior starts from there.
You all have attended deliveries, no? So, what do you think?
In the first year, baby is excessively crying, searching for breast to suck the water.
Very good.
And then what happens after the child?
After 1 hour, they go into sleep.
After about newborn, after the transition, like first cry is completed, baby has come from the soundproof and light-proof environment. So baby's first thing is trying to open the eyes and then closes. So the eye movement is the pressure. Then the body movements. He is turning his both the sides. Cannot balance himself. Him or herself. So certain jerky movements is there. So continuously moving, observing the environment. This is what the normal behavior we think that baby looks fine. If even the intrauterine some insult is there. That behavior we say, we also see that although the baby has cried, but it doesn't look okay. So that is what the behavior is.
Intrauterine insult, sir. How is that?
Very good, very good.
Excellent.
Right? So normal newborn at birth cries, goes to the breast crawl, sucks for a while, bonds with the mother, and 15-20 minutes પછી goes to sleep because both mother and babies are tired. And after another half an hour, 1 hour of sleep, wakes up and starts feeding and sleeping. This is the behavior of a newborn. And we were just discussing the other day, I saw a newborn and the parents said, કેટલું alert છે, આમ જોએ છે. Oh, that's abnormal. Okay, he could not be doing that. That was a stage 1 of an HIE, unit encephalopathy. What are we looking at? Behavior. Behavior observation starts at birth. And we only say cry. You know why the newborn cries? Why does the newborn cry? Is he so upset? Parents are happy. If he doesn't cry, parents are not happy. Doctor also. Why does he cry?
Non-physiological reasons, मस्ती वाला reasons or philosophical reasons.
सबको बताने के लिए कि मैं ये दुनिया में
क्यों आया, मैं ये दुनिया में क्यों आया.
Yeah, psychiatrists feel that. Psychiatrists feel the newborn must be feeling, I was in an air-conditioned room with a swimming pool, with no work and free food. અને બહાર આવ્યા પછી ક્યાં આવ્યા? એટલે રડે છે. But I mean, see, behavior starts right at birth. And he said that is where the foundation of a normal behavior starts. એને પછી જે અરે 15 વર્ષનો એટલો બગડી ગયો છે ને, અરે પણ કોને બગડ્યો?
So, development doesn't start at birth, but it signifies a very big transition. At last, our state mathi that state ma. That this country to that country. So, like he described very nicely, what is the state of the child inside the womb, or like Sir said, the child transits into the external world. The big difference is a change in the environment, the change in stimulation, and this is why birth is important. It's a transition. Yes.
So let's start with some cases now and let's look at the nitty-gritties of these, right? So we have a 3-month-old infant who presented with irritability and excessive crying when awake for the last 2 months, difficult to manage. On examination, growth is average. On examination, there is no other finding and development could not be tested. By the way, NAD stands for what? It also stands for not actually done. So examination not actually done. Okay? But nothing could be detected. Development could not be tested. So now the options are raised ICP, intestinal colic, hypernatremia due to diabetes insipidus, or disturbed mother-child relationship. Now you can discuss, you can ask questions, you can say why it looks this, why it doesn't look that, whatever. We'll all discuss and learn. Chalo, start.
Any questions?
Can it be raised ICP? Take one by one. Not likely. Why? Take the mic.
Because the anterior tunnel is open and as the brain has a space to expand. Usually, even if though there is an increase in pressure, it will not causes the symptoms at 3 months of age.
Very good. And what other symptom should have been there which is not there of raised ICP?
Vomiting.
Vomiting. Fantastic. So raised ICP is out. Okay.
Intestinal colic could be there because 3 months, but excessive crying and irritability, it should not be throughout. There should be some specific time.
Fantastic. So colic is periodic and this baby is crying almost all the time. Very good. Anybody else? Third option, hypernatremia. What questions will you ask, or do you have any thoughts on that?
Child is having irritability, which could be the cause of the hypernatremia.
Okay, so it is possible hypernatremia. So what will you ask?
Rajesh bhai, one important point you have written. Irritability and excessive crying when awake.
कोई देखा ही नहीं ना, problem वही है. So, sir, your quote.
No, this must be a 3-month colic. Every book has written 3-month colic. No, it happens to be continuous colic. Why should colic not be continuous? 3-month colic.
But it started at 1 month, no? So it is 1 to 3 month colic.
The point I want to make is 3-month colic is not an organic disease, but also some disturbed mind of a infant. And it's not an intestinal colic, it's a rectal spasm. And the rectal spasm makes the child very uncomfortable, cries. Typically comes at the end of the day in the evening. Why at the end of the evening? The mother is tired, has not slept the previous night because the babies are more awake at night, and she is dreading how would the tonight be. Mother is stressed, and stress gets to the baby and the baby cries. That's a behavioral problem, and therefore you must address it to the mother and get away her stress, and then the baby stress disappears. So again, it's a behavioral problem of the mother that transfers into the baby.
So hypernatremia is difficult, but you have to ask for polyuria and polydipsia. Now in a 2-month, 3-month-old it's very difficult. But what can we ask? Don't just ask urine pass hota hai na. Ask how many diaper change, this, that, but it's not easy. But polydipsia, so wanting to feed again and again or no. And now we come to the last option. So how will we fish that out?
Yes. Disturbed mother-child relationship.
I will give you a clue. That's why in Indian culture, the first delivery, you go to your mother's place for 3 months, so that your mind is at ease. જ્યારે ભૂખ લાગે ત્યારે જમી શકો, જ્યારે ઊંઘ આવે ત્યારે સૂઈ જઈ શકો, and your mother takes care of the baby also. The mother is at ease and the babies are at ease. Culture, right? Now answer that question.
Irritability and excessive crying every time when he is awake. Maybe due to he didn't find mother around when he awake, and mother could not respond to his or her cues.
So what must be the problem that the mother is not around or not responding?
Working mother,
or a postpartum depression in a mother.
Excellent. So what is postpartum depression?
Mostly females, as Sir has rightly pointed out, if a female is with in-laws, her needs are not met. Sometimes she, because of overburden of a child, rearing, since she is alone, she can goes into depression, and that could manifest in a disturbed relationship between a mother and a child, leading to neglect.
What about the mother not wanting that specific child?
Would it be unwanted pregnancy or unwanted child, gender of the child?
Cultural belief regarding the gender.
There must be some reason it's more common in girls, right? Child is crying more often, so could be the possibility that the affection that is given probably to a male child is neglect given to a girl child.
I think the commonest part that I see nowadays is every new mother, everybody around expects that she would exclusively breastfeed. And she's already tense whether she can do that. That itself starts. Okay. And everybody around is looking, are you giving formula? Are you giving water? Are you giving this? Instead of preparing her for this, they only make her. That's very, very common. And the pediatrician then sees all such things. The mother is stressed, the baby cries. and then we start looking at organic diseases. So here is a one good example where pediatrician must look at the environment, and the environment at birth is the mother, and it starts from there.
One thing I have observed that nowadays mothers, maybe she's qualified, engineer or something, they are not prepared to be mother, mentally. So they are not prepared mothers. So they get disturbed by small things. They are not, they don't have any, because they are busy in studies, all that. So even they have not seen the other children growing up in the family. Families have become short. So that casual training of a lady which was there some years back, now it is all new thing for her, and there is nobody to support. So she is very apprehensive as regards different things. As you say, there are some mothers who know that theoretically that I must breastfeed, but because of their apprehension, they have lactation, inadequate lactation and other things. Now there is nobody to support psychologically,
Absolutely.
Even medicals, we also will criticize or just give them that you must give breastfeeding.
Yeah.
But the first thing you have to study that this girl requires some
Circumstances
support.
of that.
So don't
Absolutely.
worry, it is best, like this, and you will gradually. This makes a lot of difference.
Absolutely.
I have seen so many mothers who are inadequate and inconfident in breastfeeding. After giving this good support, within a month or two, they become so confident about things, and the lactation and everything becomes normal.
Correct. Perfect, sir. Perfect.
Yes, the family support from the husband and maybe mother or mother-in-law. If it is available, this happens less. I am using one technique since last 30 years to make this type of infants calm. I will just show. I don't know if anybody is trying that or not. Usually what we do, we held the child like this. This is the head, this is the legs. We held the child like this and do like this to make him calm. But I have seen this is not working. If you grasp the child with you, attach with you, and then do like this with your knees, usually within 30 seconds the child becomes calm. And this I demonstrate to all mothers whose babies are crying more. And in next visit they say it is a wonderful technique.
Thank you. So the big applause. It's also good exercise for the mothers, for the calves. Our trainers always tell us keep doing this. So it is.
Okay. So let's move on to the next situation.
Just one second.
Yeah, sorry.
So one is this poor support to the mother from the partner or from the in-laws, and the mother is not prepared to be a mother. The other extreme is also true. Some people are too over-prepared. They have read so much on Google. They have read so much on other things that every time the baby cries or doesn't cry, they are just very worried.
Advice in the absence of seniors in the family, today it's our role as pediatricians. Because God has not made any further development up there. Because every new equipment that you buy, there is a brochure along with it to tell you how to manage it. But this fellow comes without a brochure because the God thought pediatricians are there. They will do it. They also don't do it. That's the problem. Right? So I think that is what we expect out of pediatricians.
So the pediatrician is a manual that comes with the baby. So actually on a practical note also, trust me, with this infections going down, so much of competition, etc., the practice is going to be around counseling and coaching parents, and because they don't have the knowledge or they are too worried, what sir has said is likely to become a very good practice parameter, because today it's called lactation management. अपने को लगता है कि breastfeeding का it's not only breastfeeding, it's all these things.
Okay, so let's move on. So this is a 18-month-old child who was sent from the remand home for high fever, was diagnosed as a viral infection that settled down within 2 days, but he was noticed to have delayed language development. Physical examination showed an alert child with motor milestones normal vision and hearing. So how will you judge what is wrong with this child? And our options are post-encephalitis regression, autism spectrum disorder, a genetic defect, or environmental factors. So ask us questions, what else do you want to know, and then take a call amongst all this. What questions do you want to ask anybody?
What is the behavior of first as the 18 months old child, so how is the interaction with the babies, with the other caretaker in the remand home? That is the one thing that we can get a clue from autistic spectrum disorders. The physical complete examination that gives the idea about genetic defect, and environmental factor has a very important role in such scenario.
Yes, go ahead. Any other questions?
Eye contact.
Eye contact, yeah, eye contact is there. Eye contact is there. And about interaction in the remand home, both difficulty in getting a history also, and probably they are overworked and you really don't know how much is possible. It's a gray area. Anything else? So, okay, does he play with other children? So he's 18-month-old, so it's a bit early, right?
The remand home, the interaction with the child would not have occurred that much. Might be
Very
the reason
good.
that the language would have been
Very good, very good, very good.
Why what you said was right about the caregiver, but it has been shown that to form a relationship you need the same caregiver, you need some stability. In a remand home, that situation keeps changing. So from here I'd like to move to one, so we all agree it is an environmental reason more likely, because when you examine the child he has normal motor domain, normal vision, normal hearing, normal cognition. So this question is, what is language? And second, along with it, what is communication, what is speech? So we want definitions for these three things. What is communication, what is language, what is speech?
Language is an expression of thoughts or whatever your message. It is not necessarily should be a vocal. Even a simple behavior can be a communication or it can be a language of a child. So we see many cases that cannot speak for 3 to 4 years, but they are very well communicating, and whatever the demand he wants to do, it get done by the parents. So language has been developed. Speech.
Is this because the parents are too attention giving?
Yes.
Or because the child has good non-verbal and is deaf?
The most important factor that recently we have thought that postpartum depression is more common. So nowadays the higher education, the parents, we see day-to-day parents who are trying to control each and every factor around the babies. That's what they are making them.
So the baby may not have normal language, but parents are imagining. Fair enough. Language, communication, speech.
Communication is a form in which not necessarily by speech or by saying the child communicates. Even a newborn communicates by crying or to meet the demands or to show the emotions which the child.
Very good.
Speech is like alphabet, ma, ba, ba. From that speech, when you articulate with that alphabet into the word, it becomes the language. And when you use appropriate language with your EQ and understand other ones, what you want to say, that is a communication.
We'll give some 3 simple tips, please remember, because otherwise it is very confusing and the pediatrician says something else, development pediatrician says something else, neurologist says something else, psychologist says something else. Communication is the exchange of thoughts, ideas and feelings. The exchange of thoughts, ideas and feelings between 2 or more people. Clear? Whatever is there in my mind, in my heart, ability to get it across to you is communication. But there is one caveat that we have added.
We can communicate on cell phone, no?
So that's why there is a caveat to that cell phone, which we have added. So exchange of thoughts, ideas and feelings between 2 or more people with IMP. This is our Indian modification. IMP stands for, generally stands for important. But what word we have given it? I stands for interactive, M stands for meaningful, and P stands for purposeful. So if the expression I am doing right now say in Marathi, but I have reason to believe that he does not understand Marathi. Or yet if I do it in Marathi, then it is not correct communication, because the exchange will not take place, which means not only does there have to be an expressive communication, but the expressor has to be aware that the receiver also is able to receive the way the expressor wants to express. This is the level at which you must understand it. So exchange has to happen. वो रनिंग में वो रेस रिले रेस में बैटन पास करता ना, तो सामने वाला बैटन लेके आगे भागता है. तो I have to understand that one, I have to interact. So I am speaking the same thing, but I am looking here, no interaction, no good communication. Meaningful, I understand that you understand the meaning of English words. That's why I am speaking. And purposeful, suddenly if I start talking about Kishore Kumar here, it may not be purposeful. So communication is that. Now communication has two parts, expressive, receptive. And the communicator has to be aware that what is expressing has to be received by that person also. Language, on the other hand, is a set of rules. 3 words. Never ever forget that. Set of rules for communication. And that can be verbal also. Communication can be verbal, spoken, speech, or non-verbal, ishare. So, abhi if I do like this, the rule is that you may think I am asking for water. But some of my friends, if I do like that, they will know it is something other than water. That is the rule that we have made. So, English, by language, we mean set of rules. We will call this flower. We will not call it pool. ये rule है English का. Pool is no word in English. Rule. Then I have to say I want water. That is English grammar. I subject, want, verb, object, water. हिंदी में क्या बोलते हैं? मुझे पानी दो, मने पानी आपो. Indian languages, the rules are different. Subject, object, and then verb. So every method has its own set of rules, whether it is non-verbal or verbal. That is language. Don't confuse it with communication. Communication is a bigger picture. Language is the rules which we have decided. Speech is of course a verbal part, and non-verbal is the use of gestures. But in everything, IMP is important. If I am speaking, but like I said, looking here and speaking, there is no interaction. Meaningful and purposeful. If these 3 things are not there, and I keep saying mama, 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 but I look at my mother also and say mama, mama, I look at you also and say mama, mama, I'm looking at this flower also and saying mama, mama, then what is wrong? Is it right in the first place? 1-year-old child saying mama. ये हिस्ट्री लेते हैं ना हम लोग. बच्चा बात कर रहा था कि हाँ मम्मा मम्मा बोल रहा था. Is that enough? So remember what we said today. IMP check inati. IMP. Did he look at the mother interactively and say mama? Meaningful. उसको मालूम है मम्मा शब्द का अर्थ मेरी माँ है और यही मेरी माँ है, ये माँ नहीं है. And purposeful. कोई जरूरत है तो मम्मा मम्मा कर रहा है, बेजरूरत कर रहा है, it is not correct. So a lot of times we are told child was speaking, now he has regressed. So he has a regressive disorder. It is not regressive disorder, it is poor history taking. You have not taken ki what is a true word. So I, interactive, meaningful, purposeful. मम्मी को ही मम्मी बोलता था और जो काम है तब बोलता था, अब नहीं बोलता है. That is regressive. We will come to that case also.
So now let's revise this. So we have another case. 2-year-old comes with delayed speech. So now quickly tell us what more information you will want to look at all these possibilities and rule out some and rule in some. So what will you ask? Parent has come, बोलतो नहीं, 2 વર્ષનો થઈ ગયો.
Other development.
Okay, so first you will check all other domains of development. ક્યારે ચાલ્યો, ક્યારે run કર્યું બધું. Then what else?
Hearing.
Hearing. Okay, you will check for hearing. Is clinical checking of hearing okay? हाँ? ना इन्हें संभळाय છે બધું. Is that good enough? So you should look whether neonatal hearing screening was done. It may be a good idea to reconfirm. Okay, fine. What else? What else will you check? So coming to this delayed speech, Samir just said. So you will, what questions will you ask related to that so-called delayed speech? बोलतो નથી. So what will you ask?
Screen exposure.
Huh?
Screen exposure.
Screen exposure. Okay, very good. So Samir will talk about screen exposure in a minute.
Parents' interaction with the child.
Okay. What else? Yeah, and so all of you are looking at the cause. But first step is, okay, બોલતો નથી, શબ્દ બોલતો નથી, પણ નજરથી બોલે છે, ઈશારાથી બોલે છે. Yesterday I was so surprised, sir. Yesterday 15-month-old child was brought. Chief complaint was he fell from the bed. Mother said this. And what is that 15-month-old doing? He is doing this. He was sitting on the cot and he was doing this. And then mother explained that he is telling you that I fell from the bed. My God. I was so surprised. He kept on doing this, that 15, looking at me, not non-meaningfully. He was doing, and mother is saying, तो तुम्हाला सांगतोय की मी पडला.
So I think the issue is, we are looking at how early we can pick up. Receptive language develops before expressive. How early does an infant learn or acquire receptive language? How early? If he has not done that, expression is far away. So how early is the receptive language developing?
Intrauterine.
Okay, intrauterine. 3 months, okay. Any, so why do you say 3 months? On what basis? Then we'll fine tune it.
So social smile, that is also a reception to mother's.
Fantastic.
Sir, Edward, he knows.
Fantastic. So 3 months has come down to 6 weeks.
So define social smile. Sir, I remember JJ Hospital 1997, I have heard it from him. Define social smile.
But what if mother is not there?
No, and anybody whom the child is in contact or knowing and he is trying to express and the child responds back, that is social smile.
What if that person who knows is a Rakshas? When the child smiles, is that social smile? You are right.
He will be frightened, not Rakshas.
So positive stimulus.
No, so negative stimulus.
Right.
So she is absolutely right, and I remember sir having told me social smile in JJ Hospital, sir. Social smile is a smiling response of the baby response to a familiar, pleasant stimulus. So familiar भी था and a pleasant भी था. This is what I learned from that time. Which means don't go by this, go by what's happening here. कि वो पहचानता है, पहचानता मतलब familiar है, मतलब vision भी normal है और आप pleasant हो तो smile कर रहा है. Unpleasant stimulus को smile कर रहा है बच्चा. It's not normal.
But many times when the newborn is crying, not for hunger, not for anything pain, when mother talks to the baby lovingly, the baby stops crying.
Yes.
Receptive language develops so early.
Yes.
And every time mother will say, "Na ભૂખ નથી લાગી, એમના સાથે વાતો કરવાની જરૂર છે." That means he wants the social interaction. But we start taking intestinal colic, antispasmodic. What a pity.
So when you said the word social engagement, I think that is the most crucial part. And quickly, this is something that all is made in India. Yes.
I will add one more thing to this saying mother's speech. That when I teach this thing, I also do and the child becomes silent within 30 seconds.
What is this? Why?
Humming of intrauterine environment.
One is that. Again, if I speak, every time I speak differently. But when I do how different can it be? Yeah. So it is because it is repetitive, it becomes familiar faster. So this what you are doing and this movement is familiarity. And the child knows that this familiarity is associated with safety. Because mommy, it's hati pe. So this is, so please understand, the child keeping quiet is the behavior. Don't go by keeping quiet. look inside the brain, वो क्या समझा ताकि वो चुप बैठ गया. So what we have put up here for you, because all across the world there is confusion about what is autism. The reason is because we have motor milestones which are clearly defined, but nobody defines social behavioral communication milestones, and hence nobody will directly come and say that my child should run at 2 years. But they will come and say, or they won't come and say that my child is not running at 2 years. They may say my child is not standing or not sitting, because those are visible milestones. But they'll all come and say my child is not speaking at 2 years. That is the case Rajesh Bhai showed. It's not speaking. Or what do they expect? Make the child speak. If the child is not running and if he is not even sitting, they won't tell you make him run. They will tell you pehle bithao to sahi. Because we all know sitting, standing, walking, running. These I call them visible milestones. But in human engagement, human social behavior, there are no defined milestones. So what we have defined as is the first step that has to be normal in the human child is the ability to engage with humans and ignore objects. What we call, English is called social engagement or selective human engagement, but the absolute correct term is manushya magnata or maganta. Marathi में हमें magnata म्हणतो, and Hindi में I think maganta, but the Sanskrit word is the same. Magan होना, being involved with something, giving importance to something, focusing on something, ignoring others. So manushya magnata, if the child shows, why would the child show manushya magnata? What is the reason? The reason is what sir said, that when the child feels hungry and cries, what is the response of the world? In the whole world, he doesn't understand mother kaun hai, father kaun hai, kya hai. He sees the world around, but the table doesn't move, the chair doesn't move when he cries. Only one entity in the environment moves. Then the child has a breast crawl, he feeds, he feels comfortable. Next time he cries, again he sees the table doesn't move, chair doesn't move, that same entity moves. He doesn't know कि अंदर से बोला मनमोहन देसाई के पिक्चर में आता ना 20 साल 25 समझो हमारी मम्मी है लॉकेट गले में, ऐसा कुछ नहीं है. The child understands that whenever I am uncomfortable and I cry, I get response from only one entity. तो मेरे काम का कौन है? टेबल चेयर काम तो नहीं, आज माने काम तो छे. So now the child starts ignoring the table and chair in the entire room, because there are millions of objects in the room. There is only one mother. But काम कौन करता है? Who responds to my distress call? So I have to be more focused on the person who is my savior. That instills or begins the first milestone of human engagement. मनुष्य भगनता इसके लिए होती है, survival के लिए. Once the child starts looking at the mother, he cries, mother. He cries, mother comes running and picks up the child. अरे मस्त, अभी हो गया, रोगा तो मम्मी आता है. Instant response, engagement. Sometimes she doesn't come. देखने लगता है, क्यों नहीं आ रही है? अरे रूम में है ही नहीं. अब रूम में है ही नहीं. अब रोने का क्या? रोने का क्या? फायदा. Everything is dependent on फायदा नुकसान. So the child will not cry when the mother is not in the room, but will start crying the moment she enters the room. So now the child has learned when to cry and when not to cry. The bell rings, the doorbell rings, the mother goes and opens the door. Doorbell doesn't ring, mother doesn't open the door. The child is not interested in the doorbell, but because he was observing the mother, he realizes that human behavior कैसा है. बेल बजेगी तो दरवाजा खोलना है, नहीं बजेगी तो नहीं खोलना है. Similarly, observing the mother, प्लेट्स कब रखने हैं, प्लेट कब उठाना है, खाना कब लाना है, खाना कब उठाना है, कपड़े कब बदलने हैं, कब नहीं बदलने हैं, किसके सामने बदलने हैं, किसके सामने नहीं, किसके लैप पे बैठना है, किसके लैप पे नहीं, दूर से नमस्ते करना है. When to do, when not to do is behavior. How to do is skill, very low importance. Opening the door, shutting the door, opening the door, shutting the door, clockwise, counterclockwise, eye-hand coordination. Is it a behavior? Loudly. It is not a behavior, it is a skill. Knowing when to open the door or for whom to open the door, that is human behavior. That can only come if the child has manushya magnata. the brain now starts developing synaptogenesis first 1000 days. Maximum synaptogenesis towards human engagement and human behaviors makes the brain so powerful that by 8 months the child understands. 2-month-old child, you do this, what will the child do? 2-month-old child, you do like this. Child will smile. Because the brain has not developed synaptogenesis to understand that after this, every time my mother goes away, when the child understands that this has nothing to do with the hand, it is a symbol for something else, I am going away. That becomes a message or a communication which the child understands, and that is non-verbal communication. Now the brain develops so much with all of this that by 1 year, the intelligence has gone to the level, the synapses have formed to the level. Along with this, I used to hear a sound. Bye bye, bye bye. So sound पर एक साथी symbol ही हो सकता है कि मैं जा रहा हूँ. Now the child understands the sound. Then you understand the meaning of the sound. It becomes a. When you understand the meaning of a sound, it becomes a word. So interactive, meaningful, purposeful word. And that is verbal communication or speech. 2-3 years of good vocabulary, good grammar, good pronunciation. Then the brain becomes so intelligent that on a piece of paper you make 3 lines. You are seeing 3 lines. Paper से तो आवाज नहीं आता ना. Paper से आवाज आवश्यक. But somebody teaches you ये 3 लाइन देखेंगे तो आप आवाज करो A, B, C. So reading के लिए जो brain network लगता है can only develop after these 5 stages. So in autism, the problem is not with speech or reading writing. The problem is with the first step, which is poor Manushya Bhagrata. The child is not understanding that I have to forge this engagement with my mother.
So if he has poor Manushya Bhagrata,
What symptoms will arise? What symptoms will arise? Very good. And language will still get no response to name call because he has no connection. Then he does not have social behaviors. Will he know when to open the door, when not to open the door? When to put the plates, when to pick up, where to change clothes, where whose lap to go, not go. But what are you judging it as? What are you judging it as that this child is? Please say running around or hyperactive. And that's why you are giving that name. Then, loudly please.
No pointing, no gestures, he is not interacting.
And that's why there will be a poor speech. So if you start only with speaking to this child, will it help? But most people don't understand that the child has no eye contact, he doesn't understand behavior, he doesn't understand gestures. They will start bolo, bolo. Then there is one problem because this child who has poor Manushya Bhagrata also has too much Vastu Bhagrata. He is focused on object. What do you learn from the object? What do you learn from objects? All objects, look at the roof above you, it's all in a pattern. Look at the mobile, it runs in a pattern. Look at any fan, it runs in a pattern. So the child starts learning patterns. But what is the problem with the patterns? All the patterns are rigid. All fans will move in the same direction. All YouTube will open in the same way. So the child starts doing the same thing again and again and again without understanding why humans do it. So if you directly start with this child, say mama, say mama, say mama, it is like teaching a child who can't sit, you are teaching him running. He will not respond at all. But this child may start repeating, say mama, say mama, say mama, but he will say it to the mother also, the father also, the door also, the uncle also. That is not speech because it does not have
MP.
IMP. It is echolalia, which is purposeless, meaningless repetition of a pattern that you have heard. And if you are teaching him nursery rhymes, twinkle, twinkle, little star, he may not follow the whole thing, doesn't? But he likes this pattern. So either he keeps doing this, or he keeps spinning around, or he keeps flicking his hand. And the Americans unfortunately call it impaired social behavior and communication, restricted repetitive behaviors, and they define autism by the symptoms. But we know today that there is a road to autism and there is a road to normal development, and it depends on this fact. What is a Hindi word for this? Come on, loudly. Manusya Bhagavata. If Manusya Bhagavata is normal, the child will develop normal social behavior and communication. Did you understand why? But if that is deficient, he will lead to impaired social behavior and go to autism. So what is important is, don't give this child speech, give this child human engagement first, then human behaviors, then non-verbal and verbal. So that is the case that you are saying.
I think because we have some more time left, we'll skip to some other cases. So basically we already, yeah, sir.
I think hearing testing is a must before you label that he cannot. And I recall on 2 occasions, the parents were sure that this baby can hear well. I asked her, how do you know that? She said every time she was looking at the TV, and when the advertisements come, the child comes running from outside because he's interested in the advertisement. And she said, I've seen every time. What that child was doing was, child had learned that when advertisement comes, the mother leaves the program and does a bit of work in the kitchen. So when the mother goes to the kitchen, he knew advertisements are coming. Mother's observation was right, but he was totally deaf. So don't depend. I always tell the parents, you may be sure, but I want to be doubly sure, objective. And I think it has helped on 2 occasions. Parents were surprised that he was totally deaf. So observation is not good enough to know that. For example, when he is talking, he believes I am listening. I may not be listening. So I think it's important. I thought you cannot label anybody without hearing.
Absolutely right. Clinically, 2-year-old child with delayed speech, the case that Rajesh Bhai showed. How will you distinguish between hearing impairment and autism? Clinically, you have to do a hearing test. Any child with any speech problem, do a hearing test first, and on machine, like he said. Not that rattle and things like that, because like sir said, he looks at and understands. So how will you distinguish between delayed speech as a symptom because of hearing impairment, because of autism? Come on, we discuss.
Non-verbal communication will be good in deaf child.
Correct. And in autism child?
It will be impaired.
What will be impaired?
Non-verbal communication will also be impaired.
Wonderful. I cannot tell you the number of neurologists and development pediatricians in the world. On their paper they write, child is non-verbal autistic. If he was non-verbal, he cannot be autistic. What they wanted to say, he is not verbal. એટલે verbal નથી છે. But say like that, ये बात नहीं करता, he does not speak, he is not verbal. But when you say non-verbal, you are claiming that he can understand action. If he can understand action, then he cannot be autistic. Have you understood? Next time when you see a child with speech delay, please tell yourself, this is a symptom like cough. You see a child with hyperactivity, symptom like vomiting. Poor eye contact, symptom like loose motions. Don't write this child has speech delay as a diagnosis. You can't write my diagnosis, child has vomiting, child has fever. And then if you are giving paracetamol, it is like what sir said, you are giving paracetamol for pneumonia. For some time the fever will go down. So if you give this child lot of speech training, the child will start repeating, but he will not become normal. Have you understood?
Okay. So this part of the thing is very clear. Our basics are clear. Now let's move to a different age group. So 14-year-old complained about a loss of appetite and weight, feeling tired and disturbed sleep for last 2 months, no other symptoms, and physical examination is normal, so many things come to your mind. It could be a disease like tuberculosis, it could be diabetes, it could be hypothyroidism, or it could be many other things. So that's why we have put none of the above, but many other things. So what questions will you ask and how will you differentiate? So again, from the development perspective, if 14-year-old comes with these, what will you ask?
Family involvement of the child and how parents are behaving. There must be some stress in the family.
Fantastic, fantastic. So family dynamics. What else?
Disturbance in the peer group or some.
Fantastic. So friend circle and all that. Very good. What else? What else? Okay.
Exams might be coming.
Yeah, of course. Exams might be coming. Then he said drug abuse, so substance abuse. Fantastic.
Anxiety or depression. Maybe.
Yeah, anxiety,
family pressure.
They have lot of stresses. Very good. So Samir, how can we separate out all this?
Something else that we are missing. Okay, just to be a devil's advocate. Family at 14 years, which 14-year-old is concerned about family? Is more concerned about peers. Some may not be concerned about exam also. Not everybody fortunately is to substance abuse. But what is common to all 14-year-olds today?
Friends.
And there are some today who will come and say that my child does not even have friends. He doesn't want friends. He doesn't want to go anywhere. What is he busy doing?
Another thing that is universal is iPhone.
Social
iPhone.
Mirror image.
So screen time is today the commonest cause of all these things. All of you are right. Of course, it is disturbed family dynamics, no doubt about it. Peer relationship, exam, substance abuse, child physical abuse, sexual abuse in the environment. All these things are common. But the commonest cause of fever is viral. Commonest viral is screen time.
So, how do you ask? If you ask anybody, is your screen time more, what answer you will get? Huh? ના ફોન તો બધા પાસે હોય, ખાવાના પૈસા ન હોય પણ ફોન તો હોય. No, so my point is, what is the definition of normal? What is the definition of normal? Forget development, forget growth. What is the definition of the word normal? Within 95% of the Gaussian curve. So since 95% people are on screen time more than 10 hours a day, answer you will get is no, screen time to normal che. Correct? So you have to dig and find out. So that's the way you have to check on excessive screen time.
What is screen time? On the time spent on the mobile? And TV. And iPad. And in school. So anything which is spent on a digital device. But please understand from what we discussed today, screen time is any time spent with a device away from people. If you go to watch a cinema, Rajesh bhai, myself and sir may decide aaj chalo cinema jate hain. Please understand it is not so much fascination with the film as time pass. Time pass किसके साथ कर रहे हैं? एक दूसरे के साथ. People. That is still human engagement मनुष्य बोलना था. So screen time is actually that time when the child बाजू में कोई जिंदा है या मर गया, फर्क नहीं पड़ता. I am looking at this. मेरा 1.5 GB data आवश्यक कि न था उसे शाम तक. That is that child, 14-year-old. 1.5 GB free data चाहिए. बाकी दुनिया इधर की उधर हो जाए. That is screen addiction. मम्मी चिल्ला रही है, डैडी चिल्ला रहा है, लेकिन ध्यान नहीं. That is addiction. So difference between screen time is a process. Addiction is when you don't care, no peers, no family, कुछ लेना देना है नहीं किसी के साथ, no पढ़ाई. And then when parents start saying अभी तो मैं ये screen हटा दूँगा, then the child has that loss of appetite, anxiety, depression. Because how will I then connect with my imaginary friends on the phone? That is the abuse that leads to those, because he said loss of appetite for 2 months. You feel it is not possible with screen time? Children threaten their mother कि नहीं देंगे तो मैं खुद ही मरूंगा ऊपर से. Happens commonly.
Okay, we'll do the last case and then a few sum up messages. So, mother complained that her 6-year-old child is too hyperactive, always on the move, talkative, interrupts others, is often forgetful, misplaces things, and school performance is good. Physical examination normal. Options are autism spectrum, learning difficulty, hyperthyroidism, or none of the above. So again, based on what Samir has revised for us today, what questions will you ask and what will you pick up in this scenario as the most important?
Questions you will ask.
How is the behavior with the other students in the class?
Okay. Very good. How is the behavior with the other students in the class, other friends? Then?
The thing is school performance is good. That's a important point. I mean, any disruptive behavior child will have some spectrum of some spectrum in the performance will be affected. If its performance is normal, if they are assessing all the holistic approach of the performance, then it is less likely to be autistic spectrum distortion.
Correct. So when you said that he's interacting with other children and speaking, talkative child, that means his human engagement is very good. So there is no problem in connecting to a person. Similarly, academics is good, means intelligence, cognition, memory, writing, knowing what to write, where, not where, is all good. So what you have ruled out is the autism spectrum disorder, and because academics is good, you have ruled out intellectual disability and learning disability and intellectual disability. Then what is being seen?
So is it hyperactivity? Is it a attention deficit hyperactivity disorder?
We should check whether any common environment is there when all these symptoms are happening. Such time, in every time is similar environment, then the environment may be the cause that he is hyperactive in such environment.
Okay.
So what she is saying is he showing this at multiple settings? घर में पण होय, school में पण होय, friend ना घर में भी होय, mall में भी होय. So this is very important.
That's why. So this is not at multiple settings. It's only when mother is around. Mother is the only trigger at home, right? So this is not a hyperactive child. This is a over smart child who knows how to trouble his mother and extract more from her. That's all. It's a normal child.
The one way to signify it is, besides you, mummy, और किसको complaint है तुम्हारे बच्चे के बारे में? टीचर को complaint है, मासी को है, चाची को है, नेबर को है, किसी को complaint नहीं है. Don't say तुम भी खराब है, just say ये तो वापस आएगा नहीं ना.
If we had a lot of time, we would have discussed many more things. But I think I will ask Amdekar sir to summarize this, and then we come to a few take-home messages.
I think all that we have learned so far is growth and development both are processes, and we should start with the onset of that process and still follow the process. And like the growth chart, we need to have a developmental chart, a behavior chart. That's what we have. But don't forget that sometimes the organic diseases would exactly behave the same way. The last case, for example, there was inattention and there was also hyperactivity. But when we found out that hyperactivity had a purpose, it was not purposeless, then we know that no, this is normal and he's taking everybody for a ride. So then we know that we've just tried to tell you that inattention could be disinterest and deficiency going down. One of the common causes of falling grades in the school is an iron deficiency, but we don't take cognizance of that. Impulsivity, it could be a personality trait, but it could be a brain disorder as well. Repetitive rocking, Rett syndrome here, but many times times you have such movement disorder which suits your excitement and therefore you feel fine. They're normal people.
Yeah,
This is your comment.
when you are anxious, you are rocking in your chair.
It's a
Adults,
soothing process.
yeah.
Why does one need a soothing process?
There's so much of anxiety around us in the world that all of us, even at this age, need a soothing process. We can't be in our mother's arms, unfortunately. So some of us just like to do this. Some of us may do like this. Some of us may do. So these are all processes which you do to soothe yourself. Problem or the point is like what Rajesh bhai said. Is it coming in the way of your day-to-day functioning, or what you are doing, is it coming in the way of the other person's day-to-day functioning also? So are you okay? At the same time, are others okay with you? If that is okay, you can have your own soothing process.
So I think every time we need to get into more details of the history, and you will find some clues to that. Look at poor social interaction. It could be sheltered childhood or a chronic illness itself. Aggression, defiance, self-harming. We know substance abuse, seizure-related automatism. For example, typically a focal seizure with impaired awareness, which means earlier we used to say localized seizure becomes generalized. Often such focal seizure with impaired awareness, post-seizure, they have automatism, lives back in some such thing. You start wondering what it is. It is simply something that will totally disappear by itself. Inappropriate behavior could be early encephalopathy. I know my friend's grandfather in a family function suddenly went and slapped few people. Normal person. They took him to a psychiatrist. Now, psychiatrists have no reason to clinically examine. He had a chronic liver disease, and that was an early symptom of a liver cell failure and an encephalopathy. You can imagine that how sudden change, inappropriate behavior, early encephalopathy, insomnia, parasomnia, physical illness, sleep habits, hygiene. So there are several such things. An eating problem, tics, is inappropriate play. It could be a simply habit. But just, Samir, if an older child is playing with a toy, which normally the young child should play, how do you look at it?
Very good question. Older child is playing with a toy which would be appropriate for a younger age, but not for this person. How will you interpret it? How will you interpret it? Observation, he is playing with a toy. Oh, bad. Observation, symptom. How will you analyze it now? What is inside the person's brain? Sorry?
decreased મનુષ્ય મગ્નતા કે એજ પર એક people સાથેનો કનેક્ટ આવવું જોઈએ જે નથી આવ્યું ટોય સાથેનો કનેક્ટ બધા
Super. So, vastu magnata too much, manusya magnata less. But he is taking that toy and going to mommy also. Then he is showing that toy to the mother. Our favorite touch.
Attachment to the object, less to the human, going to mother periodically because some attention must be present from the mother, not the regular attention that a child should receive from parents or from a mother.
So this toy has now become a.
Emotionally attached to the child more compared to the youth.
So this child has become a substitute. So this object has become a substitute for my emotional satisfaction because mummy, daddy, boyfriend, girlfriend, wife is not giving me that attention. The cause of substance abuse is also that. Sir, we have said a toy, literally a teddy bear. 15-year-old girl going around with a teddy bear, we will think in terms of either emotional deprivation or subnormality with substance abuse. Similar is the case today. You are of 15-year-old boy or a girl having multiple relationships everywhere. They are looking for an emotional satisfaction. So, just because a child has one particular object, same cigarette or the narcotics or that one teddy bear, that does not become vastu magnata. Because vastu magnata is for multiple objects and nothing for humans. What this case sir described is looking at an emotional substitute
at an age which you are not expected to find that as an appropriate. A 3-year-old girl going around with a doll, imaginative play, parallel play, wow, 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 wow. 14-year-old girl, no. So keep in mind, emotional deprivation, child or adolescent is looking for a substitute.
Don't you look at a girl behaving like a tomboy?
Alright. So this is a question about what we mean by tomboy. Is a girl dressing like a boy? So there are 2-3 terms here that we must understand. One is this thing is your gender or sex assigned at birth, which is totally biological sex or gender dependent upon your biological appearance, the sex organs, etc. The other part is gender identity. Who do I think I am? Am I a boy, a male, or am I more like a female? That is gender identity. Gender expression is what do I want to display? I may be a boy, but I may want to wear some, nail polish, or I may want to dress like a girl, or I am a girl. I know I am a girl, and I want to be a girl, but I want to wear clothes which are like boys. Why should only boys wear trousers and be so comfortable? I also want to wear. That is gender expression. Gender at birth or biological gender. Gender identity is what you feel, and gender expression is what you show. Ye 3 terms clear hai? The problem is when the gender assigned at birth is opposite to the gender identity I have. अब मैं express क्या करूँ? Should I express what is my inner identity, or should I not express my inner identity? It is clear to me that internally I am a girl, but should I start dressing like a girl or no? ये जो कश्मकश है, that is called gender dysphoria. It is not only anxiety. Anxiety उसके सामने छोटी सी चीज है. Dysphoria is 10 times worse than anxiety, because मैं करूँ कि नहीं करूँ, वो जो दुविधा है या कश्मकश है, that is gender dysphoria. So, if the boy or the girl is happy otherwise, she is very comfortable with being a girl, she can do other activities of a girl comfortably by choice. But she wants to dress like the brother because daddy spends more money on the boy's brother's clothes. Why not spend money on me? अभी मेरे को भी ऐसा ही कपड़ा चाहिए. That is another point of view. It is not a gender identity issue. So a girl who wants to have भाई ने पहना मैं भी ये पहनूंगी could be a rebellious girl. She has no gender problems. So a girl dressing like a tomboy, you should not label that she has a gender identity issue. Is this clear?
So now let's quickly run through some take-home messages. Very simple. So development and behavior screening is very important, and most of it is done through observation. So please observe carefully. Behavior, as we said, is how you think, feel and act. There is a wide range of normal behavior based on family, culture, environment and societal norms. So repeatedly, Samir has made a point today. Look at onset, duration, progress of behavior also, not just of growth. So for development also, make that good development chart in your mind. We don't have that physical development chart of how it went, but make it in your mind, okay? And suspect early deviation from normal and refer for further evaluation. And don't forget, we are pediatricians. Parents don't know this is a developmental disorder or organic disease. Sir has just listed the things that can happen due to organic disease, looking like a development problem. So keep in mind organic disease also, and then once you rule it out, then we know that it's a developmental disorder, and over to Samir or someone equivalent. The last word will be by Samir on.
So only one suggestion here is, remember one basic difference, so many difference between all parts of medicine and pediatrics and developmental behavioral pediatrics. When we say ODP of chief complaints, Chief complaints are dyspnea, fever, breathlessness. We know that then we take ODP, etc. In this case, the chief complaint, mother may come to your clinic say, मेरे बच्चे को स्कूल में बुली किया जा रहा है, मेरे बच्चे को स्कूल से टीचर निकाल रही है. That is her chief complaint. But the cause could be learning disability, or the cause could be ADHD or a behavioral issue which has started much earlier. So ODP is right, but don't stamp as chief complaint whatever comes out of the mother's mouth first. Because what is happening now, the child is being thrown out of school, the child is feeling traumatized about it, is not a major problem. Why is she being treated like this in school? Because the child is not performing well, etc., etc., etc. So be very careful what you label as the chief complaint and then take the ODP. So in this child, the chief complaint would have been that she was not getting good marks for the last 4 or 5 years and her academic performance was declining. मदर बोले कि वो क्या हो गया, छोड़ दो. तो क्या हुआ, मेरे को स्कूल से निकालने का अधिकार नहीं है. अभी मदर एक्टिविस्ट बन गई है, उसका चीफ कंप्लेंट उसके माइंड से, इमोशन से आ रहा है. That is not a child's chief complaint. So keep that in mind. Yeah. So these are just some videos that some of my friends always see, and I don't know whether this can play. इसका आवाज. Okay, so these are all videos which are, if you take a photograph or QR code, scan this, you will be taken to some 100-150 videos which have more or less whatever we discussed today, but in details. And you can watch them for yourself and you can share it with your family members, or you can share it with the patients if you don't have much time. You can remove my name, put your own name on that and send it, there is no problem. So take a photograph of this and you can from another device scan it, or scan it now only. You can scan it now on a QR code, you will get access to the videos. Or you can write to me or message me, my number is 773, I'll give you a card, you can send it to me. Thank you so much. And I want to specially thank Amdekar sir and Rajesh bhai for agreeing to come all this way to do this wonderful workshop, and to thank the organizers. I'll take your name there because you are representing the organizers, and Jigen bhai for representing the organizers for coming here. Thank you so much.
How much is the M-check useful, and what is your opinion about the facilities available for the treatment of these behavioral delay problem children in India?
So M-check is a very useful and a good test to do because it is quick. It doesn't require money. It doesn't. Even the mother can do it. You can do it. The receptionist can do it, and it gives you a score. So the first thing is do M-check online. It's free. Just download it. M-check online, and you on the they will ask you yes, no. You can press yes. Automatically it goes to the second question. So it gives you a score. What is the use of M-check? Between 16 months to 30 months. You can tell the mother confidently, look, your child has a developmental problem. You don't need to say autism, but your child definitely, I have screened, is at a level where he requires professional attention. Don't say I have done M-check, your child has autism or needs some therapy. That's part number one. Second is about the treatment that you are getting. Now facilities available के लिए I have a little different point of view. All of you will say that the facilities are inadequate, of course, but for everything it is inadequate. TB के लिए किधर adequate है, या dengue के लिए किधर adequate है, cancer के लिए किधर adequate है. But the point is this: when you are saying about a facility to be available, when you are saying early intervention, for example, ask yourself: are you giving paracetamol or are you giving antibiotic? Because if the child has a streptococcal pneumonia and you keep giving paracetamol, you understand what's happening. It is symptomatic treatment. So the child not speaking, teaching him speech or teaching him shape sorting, writing 1, 2, 3, 4 is only symptomatically you are targeting the child. Hyperactive child giving methylphenidate. You are giving paracetamol in pneumonia. Now, even if you have enough paracetamol for everybody, is it appropriate? It may be adequately present. Government may be giving it for 50%. or for free, it is still paracetamol. So children with autism require human engagement and coaching of the parents on that step-by-step sequence rather than what we are nowadays giving over the top. So giving methylphenidate free also is not a cure for that person's hyperactivity. So my answer would be, it is definitely inadequate. But even if it was adequate, what is more important is appropriate. So don't say early intervention, say early correct intervention.
Last question. Are online training courses equally effective? I think you are also running some of them.
So for neuromotor disorders, probably no, because neuromotor, at least cerebral palsy, DMD, you will need to do something physically with that muscle there. So for that, you definitely need a physical. The neurobehavioral ones, either if you are able to coach the parents or the child is old enough correctly, say adolescent medicine, adolescent issues for behavior, it would work. But if you are only going to say the wrong treatment online, if the wrong treatment doesn't work offline, it will not work online either. So more than the platform, it is the logic behind what you are doing. And the biggest challenge is in mental health. If in one line I have to describe what is wrong with mental health, treatment today is, one, we are copying the Western world. Two, the Western world only does symptomatic diagnosis and symptomatic treatment for mental health disorders, which is why it can never get better. And they make us feel, no, this problem is so bad that it cannot get better. Autism is so bad it cannot get normal. And then they want to keep selling paracetamol for pneumonia. So that's
every time the parents have asked me, but what is this autism spectrum disorder? I tell them that when I talk to you, the sound waves go from the ear, but not the words. Sound waves go, then they are picked up by the brain as sound waves, and then it gets to the center where they are decoded into some words. Then it goes to a center to find out, have you heard this before? Then retrieve from there, and thereafter you know what he is asking. Therefore, if you ask an autistic child, what is your name? He repeats, what is your name? The circuit is getting disturbed. Okay? Because he has all the centers, but one center is skipped and goes to the next. Then he repeats the same thing. This is the defect. He's born with that, but what's the treatment? Treatment is practice. And that is what is called a therapy. And as I've been trying to say, if he's not talking, the whole idea is not to make him talk, but the whole idea is to find out why he's not talking and correct that defect. Then he will not only talk, but will have a meaningful talk. Today parents are happy. Sir, he was not able to speak so many words. Today he speaks so many words, but they are as useless. And I think that is where we are.
absolutely. You are causing echolalia and you are causing repetitive behaviors like writing in pattern A to Z. And on the other hand, you are saying that pattern behavior is a problem in autism. Echolalia is a problem in autism. But today we are using that problem to show some so-called improvement and convince parents to keep paying it. That is probably not a very good.
Many of them have a higher IQ. So they can memorize everything, which you can't. But that is not important for them.
That is largely pattern learning, and that's why you will see that about 50-100 years back, people had this gene, but they got so much of social engagement in the house, in the childhood with chachi, masi, bua, mami, that they got this therapy for free. And that time there are not so many objects, and this object which you have in your hand is the worst, because if you had a bat and a ball, at least you needed 3-4 people to play with that bat and ball. With this object, you don't need anybody. So that is why the expression or the prevalence of autism is worsening. And that is why we must understand that pattern teaching is not the treatment or the solution. Human engagement and learning, so stop all kinds of pattern learning, because pattern learning comes from object. Stop all kinds of object-oriented therapy and start human-oriented Manushya Magnata. So what is the definition of normalcy for a child with autism? It is not being able to recite Shakespeare, because like sir said, you keep repeating, he learns in a pattern and he can recite Shakespeare or Newton's first law. But the true sign of a child and the true treatment should be, can this child stay with Kaki, Masi, Bua and Mami, who are living in 4 different households? They are not copy of the mother, but similar but little different from the mother, and those 4 ladies are also little different. કાકીના ઘરમાં રોટલી અને શાક મળશે અને માસીના ઘરમાં રાઈસ જ મળશે. यहाँ पे रोटी और शाक ही खाना पड़ेगा, चॉइस नहीं है. हाँ चाची बहुत अच्छा है, इधर राइस मिल रहा, मासी ये भी बहुत अच्छा है. The child who can adapt to kaki, masi, bua, mami without the mother, because then the mother will say no, my child only wants roti everywhere, that's a pattern. The mother is now trained to protect the child's patterns, and that worsens the child because he becomes more patterned. काके बोले ये नहीं खाने का तो खा ले, तो मत खा, खाओ पड़ से. This being able to adapt to other people is lacking in the disorder. So the treatment is making him adapt and not teaching him Newton's first law, which is actually worsening his pattern magnata. So the child who can stay 2 days with Kaki, Masi, Bua, Mami without the mother and come back, मजा आया, मासी बोले ठीक है भेज दो, that is normal. So in a child with autism, your aim should not be to make him speak, otherwise you may end up inducing echolalia, or read and write, because that is also repetitive pattern learning. Your aim should be, can he stay 2 days with Kaki, Masi, Bua, Mami are far more important than any development pediatrician or me.
Thank you so much. Thank you so much, faculties, especially Amdekar sir and Chokhani sir, Samir of course, to come and grace this occasion, and I think we all had an awesome learning, right? Yeah. It was very nice interactive module and awesome. So after a group photo, we will again have another awesome thing, and that is a food for our tongue test, awesome test. So please come for the group photo. Thank you so much.
If you grasp the child with you, attach with you, and then do like this with your knees, usually within 30 seconds the child becomes calm. And this I demonstrate to all mothers whose babies are crying more. And in next visit they said it is a wonderful technique. Thank you.
Some people are too over-prepared. They have read so much on Google, they have read so much on other things that every time the baby cries or doesn't cry, they are just very worried.
How to manage it? But this fellow comes without the brochure, because the God thought pediatricians are there, they will do it. They also don't do it. That's the problem. So I think that
for high fever was diagnosed as a viral infection that settled down within 2 days, but he was noticed to have delayed language development, a genetic defect or environmental factors. So ask us questions. What
first, as a 18 months old child, so how is the interaction with the babies, with the other caretaker in the remand home? That is the one thing that we can get a clue from autistic spectrum disorders. The physical complete examination that gives the idea about genetic defect, and environmental factor has a very important role in such scenario.
Okay, does he play with other children? So he's 18-month-old, so it's a bit early.
The remand home, the interaction with the child could not have occurred that much. Might be
Very good.
That the language would have been
Very good.
Why what you said was right. The same caregiver, you need some stability. In a remand home, that situation keeps changing. So from here, I'd like to move to one. So we have all agreed it is an environmental reason more likely, because when you examine the child, he has normal motor domain, normal vision, normal hearing.
It can be a communication or it can be a language of a child. So we see many cases that cannot speak for 3 to 4 years, but they are very well communicating, and whatever the demand he wants to do, it gets done by the parents. So language has been developed.
So is this because the parents are too attention giving?
Yes.
or because the child has good non-verbal and is deaf?
The most important factor that recently we have thought that postpartum depression is more common. So nowadays the higher education, the parents, we see day-to-day parents who are trying to control each and every factor around the babies. That's what they are making them.
So the baby may not have normal language, but parents are imagining. Fair enough. Language, communication, speech.
Communication is a newborn thing.
Use a mic.
Communication is a form in which not necessarily by speech or by saying the child communicates. Even a newborn communicates by crying or to meet the demands or to show the emotions which the child sees.
Very good.
Articulate with that alphabet into the word, it becomes the language. And when you use appropriate language with your EQ and understand other ones what you want to say, that is a communication.
Clear? Whatever is there in my mind, in my heart, ability to get it across to you is communication. But there is one caveat that
we can communicate on cell phone. No?
So that's why there is a caveat to that cell phone, which we have added. So exchange of thoughts, ideas and feelings between two or more people with IMP. This is our Indian modification. IMP stands for. So if the expression I am doing right now say in Marathi, but I have reason to believe that he does not understand Marathi, or yet if I do it in Marathi, then it is not correct communication, because the exchange will, that the receiver also is able to receive the way the expressor wants to express. This is the level at which you must understand. So exchange has to happen. वो रनिंग में वो रेस रिले रेस में बैटन पास करता ना, तो सामने वाला बैटन लेके आगे भागता है. Good communication, meaningful. I understand that you understand the meaning of English words. That's why I'm speaking. And communication, and that can be verbal also. Communication can be verbal, spoken, speech. Friends, if I do like that, they will know it is something other than water. That is a rule that we have made. So English, by language we mean set of rules. Object, water. हिंदी में क्या बोलते हैं? मुझे पानी दो, मने पानी आपो. Indian languages, the rules are action, meaningful and purposeful. If these three things are not there, and I keep saying mama, 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 but I look at my mother also and say mama, mama, I look at you also and say mama, mama, I'm looking at this flower also and say, remember what we said today? IMP check in Atiche. IMP. Did he look at the mother interactively and say mama? Meaningful, उसको मालूम है मम्मा शब्द का अर्थ मेरी माँ है और यही मेरी माँ है, ये माँ नहीं है. And purposeful, कोई जरूरत है तो मम्मा मम्मा कर रहा है. Regressive disorder, it is not regressive. I interactive, meaningful, purposeful, that is regressive. We'll come to that case also.
Let speech. So now quickly tell us what hearing. Okay, you will check for hearing. Is clinical checking of hearing okay? हाँ ना ना એને સંભળાય છે બધું. Is that good enough? So you should look whether neonatal hearing screening was done. It may be a good idea to reconfirm. Okay, fine. What else? So what will you ask?
Interaction of parents
Huh?
and child.
Screen exposure. Okay, very good. So Samir will talk about screen exposure in a minute.
Parents' interaction with the child.
Okay. What else?
Environmental factors.
Yeah, and so all of you are looking at the cause. But for I was so surprised, sir. Yesterday, 15-month-old child was brought. Chief complaint was he fell from the bed. Mother said this. And what is that 15-month-old doing? He is doing this. He was sitting on the cot and he was doing this. And then mother explained that he is telling you that I fell from the bed. My God.
Only we can pick up. Receptive language developed before expressive. How early does an infant learn or acquire receptive language? How early?
3 months, okay. So why do you say 3 months? On what basis? Then we'll
Response back, that is social.
What if that person who knows is a Rakshas? Will the child smile? Is that social smile? You are right.
he will be frightened that Rakshas.
Yes.
No, so negative stimulus.
Right. So she is absolutely right, and I remember sir having told me so. Unpleasant stimulus को smile कर रहा है बच्चा. It's not normal.
Many times when the newborn is crying, not for hunger, not for anything pain, when mother talks to the baby lovingly, the baby action, but we start taking intestinal colic, antispasmodic, what a pity.
So when he said the word something that all this is made in India. Yes.
I will add one more thing to this saying mother speech, that when it teaches.
What is this? Why?
Humming of intrauterine environment.
Okay, why is that? Again, if I speak, every time I speak differently. This what you are doing and this movement is familiarity. And the child knows that this familiarity is associated with safety. Because mummy, it's hurting very. So this is, so please understand here for you, because all across the world there is confusion about what is autism. The reason is because social behavioral communication milestones, and hence nobody will directly come and say that my child should run in 2 years. He is not standing or not sitting, because those are visible milestones. But they don't come and say, my case Rajesh Bhai should. It's not speaking. Or what do they expect? Make the child speak. And if he's not even sitting, they won't tell you make him run. They will tell you pehle bithao to sahi. Because walking, running. These I call them visible milestones. Human engagement, but the absolute correct term is Manushya Magnata or Maganta. Marathi mein hum Magnata manto, and Hindi mein I think Maganta, but the Sanskrit word is the same. Magan hona, being response of the world. In the whole world, he doesn't understand mother kaun hai, father kaun hai, kya hai. He sees the feet, he feels comfortable. Next time he cries, again he sees a table doesn't move, chair doesn't move. That same way. ये 3 लाइन देखेंगे तो आप आवाज करो A, B, C. So reading के लिए जो brain network लगता है can only develop after these 5 stages. So if you directly start with this child, say mama, say mama, say mama, it is like teaching a child who can't sit. That is not speech because it does not have I and P. I and P. It is echo, or he keeps spinning around. Come on. Loudly. Manushya Magnata. If Manushya Magnata is normal.
So observation is not good enough to know that. So I think it's important.
Test first and on machine, like he said, not that rattle and things like that. Because like sir said, he looks at and understands. So how will you distinguish between delayed speech as a symptom because of hearing impairment, because of autism?
Good in deaf child.
Correct. And in autism child?
It will be impaired.
What will be impaired?
Non-verbal communication will also be impaired.
He was non-verbal, he cannot be autistic. What they wanted to say, he is not verbal. એટલે verbal નથી છે. But say like that, ये बात नहीं करता, he does symptom like vomiting, poor eye contact symptom like loose motions. Don't write this child has speech delay as a diagnosis. You can't write my diagnosis child has vomiting. Give this child lot of speech training, the child will start repeating.
14-year-old complained about a loss of appetite and weight, feeling tired and disturbed sleep for life. What will you ask?
Family involvement of the child and how parents are behaving. There must be some stress in the family.
Fantastic, fantastic. So family dynamics. What else? So friend circle and all that. Very good. What else?
Okay, just to be a devil's advocate, family at 14 years, which 14 year old is concerned about family? Is more concerned about peers. Some may not be concerned about exam also. Not everybody fortunately. That my child does not even have friends. He doesn't want friends. He doesn't want to go anywhere. What is he busy doing?
Another thing that is universal is the iPhone.
What the commonest cause of fever is? In viral. Commonest viral is screen time.
No, so my point is, what is the definition of normal? What is the definition of normal? Forget development, forget growth. What is the definition of the word normal? Percent of the Gaussian curve. So since 95% people are on screen time more than it is not screen time to normal chair. Correct? So you have to dig and find out.
If you go to watch a cinema, Rajesh bhai, myself and sir will decide आज चलो cinema जाते हैं. Please understand, it is not so much fascination with the film as time pass. Time pass किसके साथ कर रहे हैं? एक दूसरे के साथ. People. लेना देना है नहीं किसी के साथ. No पढ़ाई. And then when parents start saying अभी तो मैं ये screen हटा दूँगा, then the child has that loss of appetite, anxiety, depression. Because how will I then connect with my imaginary friends on the phone? Knowing what to write where, not where is all good. So what you have ruled out is the autism spectrum disorder, and because academics is good, you have ruled out intellectual disability.
You should check whether any common environment is there when all these symptoms are happening.
Only one
Such time, in every time is similar environment, then the environment may be the cause that he is hyperactive in such environment.
Okay. Not a hyperactive child, this is an over smart child who knows how to trouble his mother and extract more from her. That's all. It's a normal child.
The one way to signify it is
and still follow the process. And like the growth chart, we need to have a developmental chart, a behavior chart. That's what. But don't forget that sometimes the organic diseases would exactly behave the same way. We know that this is normal, and so then we know that we've just tried to tell you that inattention could be disinterest and deficiency, for example. One of the common causes of falling grades in the school is an deficiency, but we don't take cognizance of that. Okay, Rett syndrome, yes, but many times you have such movement disorder which suits your excitement and therefore you feel fine. They're normal people.
Yeah,
is your comment.
There's so much of anxiety around us in the world that also these are all processes which you do to soothe yourself. Problem or the point is like what Rajesh bhai said. Is it coming in the way of your day-to-day functioning, or what you are doing, is it coming in the way of the other person's day-to-day functioning also? So are you okay? At the same time, are others okay with you?
You will find some clues to that. Look at poor or a chronic illness itself. Aggression, defiance, self-harming. We know substance abuse, seizure-related automatism. For example, typically a focal seizure with impaired awareness, which means earlier we used to say focal seizure with impaired awareness, post-seizure, they have automatism, lips packing, some such thing. You start wondering what it is. It is simply something that will
Trousers and be so comfortable. I also want to wear. That is gender expression. Gender at birth or biological gender. Gender identity is what you feel and gender expression is what you show. ये तीन terms clear है? The problem is when the gender assigned at birth is opposite to the gender identity I have. अब मैं express क्या करूँ? Because daddy spends more money on the boys, brothers, clothes. Why not spend money on me? अभी मेरे को भी ऐसा ही कपड़ा चाहिए. That is another point of view. It is not a gender identity issue.
Once you rule it out, then we know that it's a developmental disorder and over to Samir or someone equivalent. The last.
Because what is happening now, the child is being thrown out of school, the child is feeling traumatized about it, is knowing about that and said it, there is no problem. So take a photograph of, say adolescent medicine, adolescent issues for behavior, it would work. But if you are...
That when I talk to you, the sound waves go from the ear, but not the words. Sound waves go, then they are picked up by the brain as sound waves, and then it gets to the center. If you ask an autistic child, what is your name? He repeats, what is your name? They have a higher IQ.
Yes.
So they can memorize everything, which you can't. But that is not important.
That is different households. They are not copy of the mother, but similar but little different from the mother. And काके वाले ये नहीं खाने का तो खा नहीं तो मत खा. हाँ बढ़ से. That is normal. So in a child with autism, your aim should not be to make him speak. Otherwise, you may end up inducing echolalia.
Thank you so much. We will again have another awesome thing, and that is a food for our tongue test, awesome test. So please come for the group photo.
चीज बटर पेट अंदर चीज बटर પછી પેટ અંદર ક્યાં છે
લઈ લે જી લઈ લે મોબાઈલ
All sex for a while bonds with the mother and 15-20 minutes પછી goes to sleep because both mother and babies are tired, and after another half an hour, 1 hour of sleep wakes up and starts feeding and sleeping. So that's abnormal. Okay, he could not be doing that. Then we cry. You know why the newborn cry? When does the newborn cry? Is he so upset? Parents are happy. If he doesn't cry, parents are not happy.
मम्मी को बताने के लिए कि मैं आ गया.
सबको बताने के लिए कि मैं दुनिया में
क्यों आया? ये दुनिया में क्यों आया?
Yeah, psychiatrists feel that. Psychiatrists feel the newborn must be feeling with no work and free food. अरे बाहर आया પછી क्या आएगा? એટલે રડે છે. What I mean is, see, behavior foundation of a normal behavior structure. એના પછી જે અરે 15 વર્ષનો એટલો બગડી ગયો છે અરે પણ કોને ખબર?
To that country. So like he described very nicely, what is the state of the child inside the womb, or like sir said, the child transits into the external world. The big difference is a change in the environment.
Who presented with irritability and excessive crying when awake for the last 2 months. It also stands for not actually done. So examination not actually done. Okay? Now you can discuss, you can ask questions, you can say why it looks this, why it doesn't look that, whatever.
Brain has a space to expand. So usually, even if though there is an increase in pressure, it will not causes the symptoms at 3 months of age.
Very good. And what other symptoms should have been there which is not there of raised acidity?
Vomiting.
Vomiting. Fantastic. So raised acidity is out. Okay.
Intestinal colic could be there because 3 months, but excessive crying and irritability, it should not be throughout. There should be some specific time.
Fantastic. So colic is periodic and this baby is crying almost all the time. Very good. Anybody else?
The child is having irritability, which could be the cause of the hypernatremia.
Okay, so it is possible hypernatremia. So what will you ask?
Rajesh bhai, one important point you have written. Irritability and excessive crying when awake.
कोई देखा ही नहीं ना, problem वही है. So, sir, your quote. But it started at 1 month, no?
Because the babies are more awake at night and she is dreading how would the tonight be. Mother is stressed and stress gets to the baby and the baby cries. You must address it to the mother and take away her stress and then the baby stress disappears. So again, it's a behavior problem of the mother that transfers into the baby.
Polyuria and polydipsia. Now in a 2-month, 3-month-old it's very difficult. But what can we, how will we fish that out?
Yes. જ્યારે ભૂખ લાગે ત્યારે જમી શકો, જ્યારે ઊંઘ આવે ત્યારે સૂઈ જઈ શકો, and your mother takes care of the baby also.
Awakened mother do not respond to his or her cues.
So what must be the
Postpartum depression in a mother.
excellent? So what is postpartum depression?
With in-laws, her needs are not met. Sometimes she, because of overburden of a child, really, since she is alone, she can goes into depression, and that could manifest in a disturbed relationship between a mother and a child, leading to neglect.
Unwanted pregnancy or unwanted child, gender of the child.
Cultural belief regarding the gender.
There must be some reason it's more common in girls, right? Child is crying more often, so could be the possibility that the affection that is given probably to a male child
Exclusively breastfeed. And she already tells whether she can do that. That itself starts. Okay. And everybody around is looking, are you giving formula? Are you giving water? Are you giving this? Instead of preparing her for this, they only make her. That's very, very common. And a pediatrician then sees all such things. The mother is stressed, the baby cries.
So that nowadays, mothers, maybe she's qualified to engineer or something, they are not prepared to be mother, no? Mentally. So they are not prepared mothers. Usual training of a lady which was there some years back, now it is all new thing for her and there is nobody to support. So she is very apprehensive as regards different things, as you say. No, there are some mothers who know that theoretically that I must breastfeed, no? But because of their apprehension, they have lactation, inadequate lactation and other things. Now there is nobody to support psychologically.
Absolutely.
Even medicals, we also will criticize you, just give them that you must be breastfeeding.
Yeah.
But the worst thing study that these girls require some support. So don't worry, it is best, like this, and you will graduate. This makes a lot of difference.
Absolutely.
I have seen so many mothers who had inadequate and inconfident in breastfeeding. After giving this good support, within a month or two,
I don't know if anybody is trying that or not.